Hi, I'm Kristen with NevadaPain.com, and today we talk with Dr. Nicole Kibler about chiropractic adjustments.
The most common procedure performed by a doctor of chiropractic is that of a spinal manipulation or chiropractic adjustment. The purpose of this type of treatment is really to restore motion into joints, alleviating pressure on nerves. In doing so, what we do with the chiropractic adjustment or spinal manipulation therapy is that we introduce a mechanically applied controlled force into a joint that may be restricted or hypomobile as a result of tissue injury. Tissue injury can occur for a couple reasons. It can be the result of a single traumatic event, such as lifting something improperly, or as a result of repetitive stress or strain, like sitting in an awkward position for an extended period of time, having poor posture in doing so. As a result of these two situations, there are both chemical and physical changes that occur within the tissues themselves, resulting in inflammation, pain, and decreased function for the sufferer. The treatment of spinal manipulation not only restores proper movement, takes pressure off the nerves, but it also helps with tight muscles. It encourages tissues to heal as well. Okay, I'm going to be demonstrating a few different chiropractic techniques. The majority of them are done hands-on, but some require the assistance of special instruments. So because each patient is different, your chiropractor will choose the most effective treatment for you. The first technique I'd like to demonstrate is that of the toggle adjustment, which is where I'll press down firmly over that region of the spine where the joints are hypomobile or not moving very well, and with a quick and precise thrust, we'll adjust the vertebral segment in order to introduce motion into the joint again. Okay, so this is a demonstration of our toggle technique. Okay. So, McKenna, I'll have you take a deep breath in and out. Good, and all the way out. Great. Wonderful. The next technique I'll demonstrate is that of a table drop technique. With a quick thrust at the same time that table's dropping, of course, we'll be able to introduce a movement into the pelvic region or lower back, which results in a much lighter adjustment. So this approach is very helpful for those patients that may have pelvic torsion, hip alignment issues, or sacroiliac or SI joint dysfunction. So all of our tables are very comfortable. I know this may look a little bit intimidating, but we can adjust the table for those patients that may be pregnant or for those that may have a larger abdomen. Additionally, the drop piece is in this section here, so it just drops forward. So I'll demonstrate that drop type of adjustment. Okay. You'll hear, of course, a loud noise. That's just the table dropping downward. Again, this results in a much lighter and gentler type of adjustment. The next technique is that using the assistance of an instrument, a specialized instrument that's spring-loaded. And this type of instrument is called an activator. It's a spring-loaded tool. You'll hear a clicking noise, but it's one of the gentlest forms of adjustment. So we like to use this technique for those patients that wish to avoid the clicking or popping type of adjustment, or for those that have osteoporosis. So on those segments of the spine where the joints may not be moving freely, we'll just do a little bit of pressure with the tool, introducing that very light, gentle motion. This is also a great technique to use for extremity adjusting, such as the carpal bones within the wrist. The final technique that I'll be discussing today is that called the lumbar roll spinal manipulation or chiropractic adjustment technique. In order to do this type of adjustment, we do a quick and precise thrust through the area of the disc, nerve, or joint involvement, which helps restore proper motion within the joint. It really decreases pressure off those nerves as well. For this technique, many times we may hear a clicking or popping, which is actually a very positive thing, signifying that there's been some release of the pressure or gas within the joint itself. So for this technique, I'm going to be putting pressure on the lower back, counter pressure on the shoulder area. It's a very light movement, so McKenna, I'll have you take a deep breath in and out. Good. Very good. Go ahead and relax your legs.
For more information about chiropractic adjustments and other treatments and conditions, check out NevadaPain.com. We change lives here.